I was once a student. Of course, I'm still learning, but I was once a student, and I know I've heard sometimes it could be to analyze different parts of the questions, and sometimes we skip very important parts, the very important keywords of the question defined in words, and we jumped into choices, which is a common mistake that we do. And I promise you guys that to at some point we'll be having this session doing solving some clinical scenarios together, and I think now we are good to go. But one thing first, you need to have passed through the videos, because what we are doing here is to try to utilize the knowledge that we have been accumulating in previous videos, to be able to answer questions, to be able to approach different clinical scenarios. So otherwise you'll be lost if you haven't watched the videos and you're trying to you might understand this question, but maybe if the different questions are twisted a little bit, you might not be able to to answer. So I think I wouldn't like to talk too much, so let's get started. So this is the question, and the question is: a 67-year-old man presents with sudden loss of vision in the left visual field of both eyes, and neurological examination, including pupillary light reaction, is otherwise normal. So, where is the most likely site of infarct, or where is the most likely site of the stroke? So, easy peasy, huh? Yeah, so try to think about it. I'll give you 3 seconds to think about it. You can pause this and try to give it a thought, and we continue. So 1, 2, 3. So let's go. Okay, so let's now define the question. So we have the sudden loss of vision in both in left visual field of both eyes. So all the eyes are affected. Remember, rule number 2 in the visual field defects is that anything that occurs before the optic chiasm will have the presentation or confined to one eye. Anything that touches the optic chiasm all the way to the visual cortex will have the symptoms in both eyes. So we have bilateral symptoms. Anything that occurs before the optic chiasm will have the symptoms localized in one eye. The symptoms will be confined to one eye. Having said so, what do you think? Can number one give the bilateral effect? Yes, because the optic tract is behind the optic chiasm. What about the optic nerve? So the optic nerve and the optic nerve are out of choice. They are out of choices because they are before the optic chiasm, so they will never give the bilateral effect, the bilateral binocular effect. So what about the occipital cortex? Yes, and the occipital or the visual cortex, they will all give the presentation in both eyes, so they are included. But let's go back to the question. So there is left visual field loss in both eyes. What do we call them? We call them the left contralateral hemianopsia. So the left contralateral hemianopsia. For we to have the left contralateral hemianopsia, what do we need to damage? All this information will go to the right optic tract all the way to the right the right visual cortex. remember because we have the ipsilateral temporal fibers and the contralateral nasal fibers, so they will project to the right side of the brain. So we have the left visual spaces. They will project to the right side of the visual the right side of the optic tract all the way to the cerebral cortex. So this is to say the option E is also out of choice because it is the left visual cortex. So what have we remained with, guys? We have remained with the right optic tract and the right occipital cortex. So give it a thought again. So think about it. So what do you think would be the answer between the two? So I tell you what, let's go back here. Let's go back to the question. What does it tell us? It tells us that the neurological examination, other neurological examinations are fine. So include the pupillary reaction is fine. So the pupillary reaction, it wasn't just a random statement in this question. It was a keyword. What does it mean? Because we know we have, now we see now you see, like we were doing the visual pathway, and the midst of the visual pathway we have the pupillary reaction, and this is why it is important to have the knowledge of pupillary reaction backed in at the back of your mind. All right, so if the pupillary reaction is okay, what does it mean? It means let's recall a little bit on the pupillary reaction, the pathway. So the afferent fibers of pupillary reaction occurred within the optic nerve and the optic tract. And remember, there we have the extrageniculate fibers that will go to protector area. The extrageniculate will go to protector area. So this is to say, if the pupillary reaction is okay, where the optic tract, the optic nerve, the optic horizon, they are completely fine. For you to be able to for you to have a normal pupillary reaction, you need to have your optic tract intact. So what does it mean? It means the right optic tract has got no trouble, has got no problem, and the answer will then be the right occipital cortex. Was it hard to you? Tell me in the comment, and please subscribe, because we're going to have a lot of these questions, and so stay tuned and see you next time. Ciao.